WAJR's Ask the Experts. It's being sponsored by HealthWorks Rehab and Fitness, and we're joined in studio by Dr. Chad Makuchi, an orthopedist, and Mark Hose, who is a physical therapist at HealthWorks in their Blacksville location. All right, guys. We have come to expect people getting knee replacements and hip replacements, and the shoulder replacement is now starting to become more and more popular. Chad, when does the decision come about where it makes sense to do a full shoulder replacement? And oftentimes, what's that demographic? Who are these people age-wise, and normally why do you do it?
Sure. So just like with the other joints, I mean, it's an arthritic joint. So first off is, people sometimes don't really understand exactly what are we talking about when we talk about arthritis. So it's not something we can go in there and remove little spurs and things like that. The cartilage that you were born with has degraded. And so now you have bone rubbing on bone. So those are the people that go down the road towards needing a replacement. So again, we still utilize conservative treatments. Therapy is still part of that in regards to trying to maintain some of these patients with their motion. Certainly that can become an issue with pain related too if you really have significant arthritis. Injections still play a role. So those patients, I'd say maybe 60 and older would be the age demographic. Once those conservative treatments fail, shoulder replacement is an excellent surgery. In regards to the shoulder being a non-weight bearing joint versus the knee and the hip, I think it's a big difference in therapy for people. Certainly there's pain with any surgery, but I think the rehab, if I would compare it to a knee, I would say is significantly easier. There's not as much therapy, a lot you can do on your own. And I think the biggest thing is just pain relief. Like all of these shoulder issues we've talked about, including the rotator cuff, pain is a big component of this, night pain being one of the main issues.
Yeah.
And that's when people say, look, I'm ready for a replacement.
What's the efficacy when you do it? I would imagine people come back in your office and they're smiling because before they couldn't even put themselves down to sleep, right?
There's no question. So shoulder replacement, even if you took the patient who didn't get the best motion post-operatively, they're extremely happy just because of the fact they don't have that dull, the achy, that deep aching bone pain that they've had, and they're sleeping. They're happy without question.
Let's walk through when that decision is made to have that procedure. So they've been doing physical therapy, chances are. It doesn't give them the relief that they want. You go ahead and you do the procedure. Is it outpatient or is it stay overnight?
So most of the time it's one night stay. There is a trend to outpatient total shoulders, and that's the same with knees and hips. But for right now, most of the time it's a overnight stay.
Okay, so how long after they leave that they go to hook up with the Mark Hoses of the world and the folks at HealthWorks for physical therapy?
In my patients, and now it does depend on the type of shoulder replacement we do, because there's some where we may be repairing a rotator cuff in addition. So we might slow that person down in regards to therapy. But I'd say on average, probably at 2 weeks.
They start in. Once you get them, Mark, so walk us through what is the normal protocol for someone coming back from that?
So normally when somebody comes in that has the shoulder replacement, and we're looking at the orders and seeing what the doctor actually did. If it was just a straight shoulder replacement, if it was a reverse replacement, if they had to repair the rotator cuff. And from there, we kind of start dictating, based on what the doctor's orders are for the protocol, when we can start getting them moving. And usually that first day, if we're allowed to, we are trying to get that shoulder moving again. We are working on the pain control using the modalities with the ice and the E-stim and those type of things. But we're trying to get them to start moving their arm again. And they start noticing that their arm is moving a little bit better and it's not as painful. And then we give them a home exercise program. We start progressing from there. And as their motion starts improving, then we start the strengthening aspect of their shoulder and working on their shoulder blade, kind of getting those proper biomechanics with it again, and just kind of progressing as they feel fit and as allowed by based on what was done to their shoulder.
What length of time is physical therapy normally used coming back from a shoulder replacement?
Normally we tell them, if we get them usually, right after their surgery, I will tell the patients, this is about a 2 to 3 month process probably sooner if you start feeling good and you really start getting the improvement with it. But this is a good time for us to really get that function back in your arm that you haven't had for a long time. Let's get the function back. Let's get you using that arm again and kind of getting you feeling like it's a useful thing again. Because normally, before they've had the surgery, they weren't using that arm effectively anyway. So we want to get them back to where they feel good. And that first, 2-3 months is a real good time for us to really start getting that movement again, that strength and that function.
Successful result from that surgery. Can you pretty much do everything once you're all healed up?
Yeah, I think I would say for activities of daily living, I think 100%.
Mm-hmm.
There's going to be some issues. Say you may not be able to reach back behind your back and scratch that spot you were able to reach before, and maybe for a female, maybe fastening a bra or some of those things. But I would say, with most activities, you're doing 100% of what you want to do.
Yeah, it's fantastic. And you do a lot of those, don't you?
We do.
In the biz, you're a shoulder guy.
I am I'm becoming a shoulder guy.
He's a shoulder guy. He's a shoulder guy. Well, we encourage people to come out and see you guys Wednesday night, October the 30th, at, once again, the Taj Mahal of HealthWorks. That would be the Maple Drive location. And these guys will be there at 7 o'clock. It's HealthWorks for You, part of their seminar series, and it will be focused on shoulder pain. Again, no reservations are needed. But if you'd like to give them a call and you need more information, it's 599-2515. That's 599-2515. Guys, thanks so much for being with us.
Thank you.
Thank you.
It is Dr. Chad McCucci and Mark Hose from HealthWorks Rehab and Fitness. Hope you've enjoyed the show. Thanks for being with us here on WAJR's Ask the Experts.